แดงแดงโนดวงแพงอายนี่นาโนดวงตาอายนี่เอ้ยอายนี่เอ้ยโนดวงตาอายนี่เอ้ย
Celui-là, c'est conduit à les gens qui viennent. On est quand même...
Okay, thank you. Good morning. Welcome back. Excellencies, honorable ministers, distinguished guests, ladies and gentlemen, thank you very much to our loud performers for a wonderful way to start off the celebration this morning on the progress we've made together since we last met here in these halls. My name is Valery, and I'm the Senior Director for Global Health at the United Nations Foundation. And for those of you unfamiliar, it's what UNF connects ideas, people, resources to the UN in the face of some of today's most pressing global challenges. I've also been a proud member of the World Health Organization. It is my great pleasure to be your moderator and your guide in this morning's high-level segment. I'm very excited about this year's World Health Assembly, full agenda, and sharing some of that excitement and energy with you over the next 10 days. This high-level segment is part of the vision of the Director General, Dr. Tedros, for a WHO that is open, transparent, collaborative, with a view towards innovation to ensure that we have tangible outcomes. So today, we will hear stories on our quest for universal health coverage, take some time to reflect and recognize health leaders from around the world, and also to hear from some up-and-coming health leaders who are already having impact in her own country and beyond. And finally, we will hear the Director General, Dr. Tedros, in his address on his views of the achievements, the way that WHO is transforming how it works, and our road ahead together. So it takes the contributions and efforts of everybody in this room to make the kind of progress and impact that we are seeing in the world today. And we'll see just a small fraction of that here in the room. So I'd like you to think of this event as a tribute to all of our collaborative efforts so that we can appreciate the contributions of one another, also learn from each other's experiences, but really to take that moment to feel the inspiration that sometimes gets lost in the rush to get things done in our day-to-day work. We will also take a moment to honor and remember those who have lost their lives and suffered injuries in their quest for global health, and our shared collective vision that no matter where anybody lives in the world, everyone should have the right to the highest standard of health and well-being. And this assembly marks the end of the 70th anniversary of the World Health Organization, where the overriding theme throughout the year and objective has been universal health coverage. We'll continue to reflect on UHC here in the General Assembly and in the debate, and we'll also work to prepare for the UN General Assembly, where there will be a high-level meeting on UHC in September in New York. And finally, just a reflection of the number of lively events taking place, not only in the Palais, but throughout Geneva over the next 10 days, showing the interests of partners, of all of you, whether it's the UN members, member states, civil society, and beyond, of our shared commitment to UHC. And so it shows us that really we cannot make any progress without that kind of partnership, because the collective challenges of today require our collective action. And so now, I'd like to invite us to watch a short video that captures just a small fraction of what WHO and its partners have achieved over the last 70 years, the challenges, as well as the importance of our continued efforts together.
Let us take a moment. One moment for the 7 decades spent promoting health, serving the vulnerable, keeping the world safe. Time spent protecting with new vaccines, groundbreaking treaties and global standards, billions living longer, healthier lives. Working with local and global partners like you, the impact of 70 years of our work is staggering. But time does not stand still, and facing continuous challenges, neither can we. Together we must take urgent steps to ensure our brighter future, to achieve the Sustainable Development Goals and reach our 300 billion target. 1 billion more people with universal health coverage. 1 billion more people better protected from health emergencies. 1 billion more people enjoying better health and well-being. The road we face is steep, and it cannot be traveled alone. We are building a future redefined by new partnerships and collaboration, working better, faster, and more efficiently to change the face of global health. Within 5 years, we could save 30 million lives, ensure that people live longer and healthier lives, and stimulate up to 4% of economic growth in low and middle income countries. If we invest in health, we can reduce poverty, create jobs, foster gender equality, and promote development. There is no commodity in the world more precious than health, and we need your continued support to safeguard it. We have come so far in 70 years. Let us create a healthier future together.
There is no commodity greater and more precious than health. But it takes action to achieve that kind of aspiration and notion, whether it's political commitment, partnerships, putting policies into practice. And so I'm very pleased to introduce our first speaker, who ensures that these policies and practices are evidence-based. He actually makes science cool in our pursuit of universal health coverage, And so I'd like you to join me in welcoming Dr. Richard Horton, Editor-in-Chief. Oh. Okay, hello. Hello, Dr. Tedros. Nice to see you. Sorry. I was informed they were coming on the stage after. Sorry. Okay, so I'd like to invite Dr. Richard Horton to please provide us with a few remarks. Thank you. Excuse me.
Director General, ladies and gentlemen, I asked friends in the global health community what I should say to you this morning. Here are their top 5 recommendations to you. First, declare a planetary emergency to address the effects of the climate crisis on health. Second, women's rights are human rights. Commit to delivering sexual and reproductive health and rights for all, and demand gender equality in health leadership. Third, invest in safe surgery and anesthesia. 5 billion people on our planet lack access to both. Fourth, health is a whole of government issue. Next year, bring your ministers of finance. And finally, please, 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 support the Director General, Dr. Tedros, and fully fund the World Health Organization. No ifs, no buts, no earmarks. Today is a time of growing political tensions and rivalries, misunderstandings and misinformation. At such moments, it is perhaps wise for us to pause and to question ourselves and our assumptions about who we are, about what we do, and about why we do it. 500 years ago this month, the great anatomist, and much more, Leonardo da Vinci died at age 67. In his reflections on life, Leonardo wrote, "Medicine is the restoration of discordant elements." Leonardo was thinking about discordant bodies and discordant minds. But one could also add today, discordant societies, discordant nations, and a discordant world. We do indeed live in discordant times. The aim of the Sustainable Development Goals is to promote a unified vision of cooperation among countries to navigate our peoples to a safer, more prosperous, and more flourishing future. Universal health coverage is for you, as it is for me, the anchor of that vision. Universal health coverage is an idea for the kind of society we want to live in. Kind, benevolent, generous, caring, and compassionate. The World Health Organization and your governments have embraced universal health coverage as your moral, as well as your development mission. But I think we are living at a moment of danger. Progress in health is not inevitable. The gains that we have made are fragile. Falls in mortality are stagnating. New risk factors are rising to perilous levels, from pollution to overweight and obesity. We are seeing striking new disease trends: diabetes, opioid dependence, Ebola. Conflict is now the fastest growing cause of injury-related deaths. Women have longer life expectancies than men, yes, but they live more years with poorer health. There remain critical shortages of health workers, and the fact is The fact is that no country represented here today is on track to meet all of its health-related SDG targets. Part of the difficulty is our conception of universal health coverage. Universal health coverage is not a technical matter of building blocks to be assembled, a cube to be traversed, or a destination to be reached. It is a permanent and tough political struggle. Universal health coverage is not only about coverage, it is also about quality. More people die from poor quality health care than they do from not using health care. Universal health quality is not only about health services, it is also about addressing the social, the political, the economic, the commercial, and the environmental determinants of health. And universal health coverage is not, sadly, created in halls such as this, or even created in the pages of medical journals. Health is created among families, among communities, and within neighborhoods. The quest for universal health coverage fosters great optimism and hope. But universal health coverage can also present us with doubts and uncertainties. The strength of a health system cannot be separated from the strength of a society. The quality of political institutions, the rule of law, a free press, the absence of corruption, order and security, and the protection of fundamental rights. The struggle for health is also the struggle for a just society. We are not striving for universal health coverage in a static world. Our societies are dynamic, and governments, policymakers, and the World Health Organization must therefore take a long-term view. Take demography and health as one example. The global demand for cancer chemotherapy will increase from around 10 million people in 2018 to 15 million people by 2040. And 2/3 of those people will live in low and middle income settings. It is true that advances in health increasingly depend also on advances in knowledge, advances in the transmission of knowledge to create an educated citizenry, advances in knowledge for translation and implementation, and advances in knowledge simply for the value of knowledge itself. Schools and universities, science and research for girls and boys, for women and for men, are indispensable investments for protecting and advancing health. There are also genuine hazards to human health that we must confront, hazards that we continue to underestimate. We still have not fully understood the meaning of sustainability. That sustainability concerns every single one of us, not merely some of us. That future generations are as important as our own, intergenerational equity. The oneness of life, that the human species is a part of a complex and diverse biosphere. The symbiosis between life and our planet, and the centrality of our choices that we make for the survival of that life. That is why we have proposed the idea of planetary health, the health of human civilizations and the natural systems on which they depend. For planetary health is an opportunity to integrate actions on health with actions on environments and economies, on poverty and inequality. Our approach to health and to universal health coverage cannot continue in the same way. Business as usual is not an option. We need to talk less and we need to listen more. Listen to people in poorer and more precarious communities, to their solutions as well as to their concerns. Our progress should be measured and judged by the health and the resilience of the most vulnerable and the most marginalized. Now, we have pivoted from a Millennium Development Goal era of vertical programs to an SDG era where we are emphasizing universal health coverage. But we must beware false dichotomies. Strong vertical programs in women's, children's and adolescent health, non-communicable diseases and mental health, injuries and violence, nutrition, neglected tropical diseases, AIDS, TB and malaria and other infectious diseases, and immunization. All of those are powerful means to accelerate progress to universal health coverage. Do not underinvest in those programs. Universal health coverage cannot be achieved without them. And an additional question is this: how do you and I see one another? Our words are good. Healthy lives for all. Leave no one behind. Universal health coverage, everyone, everywhere. But do we really mean these words? Racism, anti-Muslim hate, anti-Semitism, the vilification of migrants and refugees, gender inequity, and discrimination in subtle ways at all levels of society. These are health issues, and they are also issues about who we are as human beings, about who you are, and how you treat others and would want to be treated yourselves. The scorecard of humanity is stained with our deceits and our deceptions. 10 weeks ago, I underwent treatment for metastatic cancer in the United Kingdom's outstanding National Health Service. I needed immediate, high-quality surgical and medical care, and I received it, free at the point of need. I owe a personal debt of immeasurable thanks to the health workers who make the National Health Service the precious and loved institution that it is in my country. And I owe thanks to every government of every political shade since 1948 that has supported and continued to invest in the National Health Service. I can tell you, there's very little beauty in disease, but there is inspiration to be found in health, because the idea of health stands for a set of values that can guide us to a truly sustainable world. The right to health and to health care, equity, solidarity, liberty, social justice, and science. The Kenyan writer Ngugi wa Thiong'o has pointed out the hypocrisy of our good intentions. He wrote, "The ethical imperative at the core of development is the notion that health is health only if it is rooted in the illness of another." In other words, you and I cannot be satisfied if health is delivered for a minority at the expense and exclusion of the majority. From this World Health Assembly, we must issue a call to engage, to join the struggle, to protect and strengthen the values that we share, with health and universal health coverage as our ultimate objectives. This is our common purpose. And with your commitment, your tenacity, and your ingenuity, it is a purpose that we can and we will achieve. Thank you.
Dr. Horton, thank you. And I believe the Director General would like to give you a special, yes, please. Thank you. So the Director General is giving Dr. Horton a special Director General's Recognition Leadership Award. Thank you very much.
You know Richard Horton, he doesn't need any recognition. He's a distinguished global health leader. And that's the award. As he had said it himself, he's fighting cancer now. And of course, he appreciated NHS, and it's true. And he appreciated the health workers who are helping him now, and that's true. But he is also a very courageous fighter. And fighting cancer is not easy. And thank you so much for joining us. And you can see UHC in action, which is NHS in action. Thank you so much again. Thank you, Richard.
Thank you, Director General. Yes, please sit down. Thank you. And now we'll watch another video about universal health coverage, please.
Together, we've made monumental progress, helping people live longer, healthier lives. Together, we've helped treat 1 billion people for neglected tropical diseases and prevented flu pandemics by testing and monitoring over 4 million flu specimens. Today, nearly 60 countries have adopted our HIV guidelines on self-testing into national policies. We've protected 4.7 billion people from tobacco, thanks to our collaboration with over 180 countries on the Anti-Tobacco Treaty. We've helped give millions of people access to safe and effective medicines, including new vaccines against meningitis and Ebola. Today, countries around the world are putting in place global standards for air and water quality. And they are adopting WHO's new initiative to eliminate trans fats from the global food supply. Partnerships make all this possible.
And those partnerships are possible because they're made up of individuals who work so hard to drive the progress that we see. And so now, Dr. Tedros would like to present and recognize all of the 2019 health leaders, those individuals who have made outstanding leadership contributions to health. So this year's plaques will go to 6 recipients, and we'd like them to come to the stage individually. Okay. The first recognition is to Her Excellency, Madame Antoinette Sassou Nguesso, the First Lady of the Republic of Congo, for her contribution to the control of sickle cell anemia in the WHO Africa region. Congratulations, please. The Director General will give you his. Thank you. Great. Thank you, Madame. Go this way. Thank you so much. The next recognition goes to Professor Peter Figueroa for his contribution to public health in Jamaica, the Caribbean, and globally for over the past 4 decades. Congratulations, Peter. No, thank you. This next recognition is posthumous in the memory of Dr. Jaiko Fatafea Luvini for her work to serve the disadvantaged and improve health in Fiji and internationally, as well as for her efforts as an advocate for health, social welfare, and women in the Western Pacific region. Minister Ifirimi Wakanabete will accept the plaque on her behalf. And now, Professor Sir Michael Marmot, for his long-standing work on health inequalities, as well as his groundbreaking engagement in several international research efforts on the determinants of health. Oops, congratulations. And the next recognition goes to Dr. Viroj Tangcharasan Satyan for his contribution to public health at the country and his Thailand, as well as at global levels. Congratulations, Dr. Viroj. And the final recognition goes to His Royal Highness Prince Khalifa bin Salman Al Khalifa, the Prime Minister of the Kingdom of Bahrain, in recognition of his leadership in advancing health. Minister Fakwa bin Saeed Al Saleh will accept the plaque on His Royal Highness's behalf. And I understand the minister would like to say a few words. Here, let me join you over here. Why don't you stay here with Dr. Tedros? Okay.
بهذه المناسبة يشرفني أن ألقي على الحضور الكريم كلمة صاحب السمو الملك الأمير خليفة بن سلمان آل خليفة رئيس الوزراء الموقر بمملكة البحرين. السيدات والسادة، السلام عليكم ورحمة الله وبركاته. يطيب لنا أن نتقدم بخالص الشكر والتقدير إلى معالي الدكتور تدرس أدهنام غبرياسس المدير العام لمنظمة الصحة العالمية على هذا التقدير والتكريم الذي نعتز به كثيراً، حيث أنه يأتي من منظمة عريقة تحمل رسالة إنسانية نبيلة، كما أنه يرتبط بما حققته مملكة البحرين من إنجازات كثيرة في قطاع الصحة الذي يشكل حجر أساس لخطط التنمية المستدامة التي تتبناها المملكة. لقد كان للقطاع الصحي النصيب الأكبر من اهتمام حكومة البحرين، والتي عملت على توفير بنية صحية عصرية ومتطورة والارتقاء كماً وكيفاً بالمنشآت الصحية والعلاجية وتزويدها بأحدث الوسائل التكنولوجية دون ما إغفال لتطوير الكوادر البشرية وتأهيلها وفق استراتيجيات وخطط وطنية ممتدة ومتجددة عبر السنوات. وما لا شك فيه أن هذا التكريم يمثل حافزاً لنا في مملكة البحرين على مواصلة بذل الجهود في الارتقاء بخدمات الرعاية الصحية والعلاجية وجعلها أكثر مواكبة للاحتياجات المتزايدة في ظل الزيادة السكانية والعمرانية. السيدات والسادة، إننا نعتز بتعاوننا المستمر القائم مع منظمة الصحة العالمية في كل ما من شأنه دعم خطط وبرامج المنظمة في تحقيق أهداف التنمية المستدامة، ونؤكد اهتمام مملكة البحرين على تعزيز هذا التعاون، وبصفة خاصة من خلال جائزة خليفة بن سلمان للتنمية المستدامة لندعم بذلك أهم أهداف منظمة الصحة العالمية في مختلف المجالات. وننتهز هذه الفرصة للإشادة باجتماعات منظمة الصحة العالمية لهذا العام، والتي تحمل شعار التغطية الصحية الشاملة، عدم ترك أي أحد خلف الركب، مما يؤكد دور المنظمة في تحقيق أهدافها السامية في خدمة البشرية، مقدرين بكل اعتزاز دور المنظمة في تحقيق أهداف التنمية المستدامة والرعاية الأولية ومكافحة الأمراض السارية وغير السارية. وختاماً، نجدد خالص الشكر والتقدير لسعادة المدير العام للمنظمة، ونعرب لكم عن تمنياتنا بدوام النجاح والتوفيق واللقاء بكم في مملكة البحرين. صاحب السمو الملكي الأمير خليفة بن سلمان آل خليفة رئيس وزراء البحرين، وفقه الله. شكراً جزيلاً.
Thank you, Valery. Thank you so much. Okay. So I'm very pleased to introduce our next speaker, who is a future health leader and already having enormous impact in Zambia and beyond. At age 18, Natasha Jabesa Wang Mwanza has considerable influence in Zambia and is boldly using it to change conditions for adolescent health issues. She's a first-year mass communication student at the Zambia University, and she's been researching issues and commentating since she was 12 years old. She's pushing boundaries to change the status of adolescent health and how adults engage with children's rights. So please welcome Natasha.
Good morning, ladies and gentlemen. How are you all doing today? So, well, when I was called up here to give a speech, I am a very young person, and so please allow me to be free. I may not be as formal as everyone else, but you get the point, right? Allow me to recognize the following people firstly: the President of the World Health Assembly, Honorable Ministers, Director General Dr. Tedros, Excellencies, distinguished delegates, ladies and gentlemen, and dear young people. I just want to start with a basic icebreaker. How many took part in the walk the talk yesterday? I did. How many are still feeling a bit tired on their legs? I do. But it was a really amazing walk. And so for me, seeing all those people coming together made me realize how great of a responsibility and task I have been given today. Opening these remarks is something that every young person would consider a dream, not just me alone. For a very long time, young people have not always been considered. Our voices were not always heard at such high levels. And so for us to actually have this much power, come into such an assembly, and for you to give us the opportunity to speak out and have our voices raised on such issues to influence and change the agendas of our lives is a great win for us. So I take this very proudly and very highly, and I value this opportunity. Thank you. I just want to emphasize something before I begin my remarks. These remarks may not be new, they may not be solutions or problems that we've never heard of before, but that does not mean that you should take them as cliche. They are very important. The fact that we keep emphasizing on certain problems and issues does not mean that we should become reluctant. It means that our voices, our ears rather, have to hear the cries of people, the cries of the problems that we're facing, and something has to be done. So this is a call to action to the problems that I'm going to mention and for these solutions. So please take this very seriously. In the world today, the world today consists of more than 1.8 billion young people. The growing number of adolescents and young people represents a great opportunity for us to, one, harness the demographic dividend and so many other things. But it also is associated with great challenges related to health, education, employment. And today, around the world, especially in Africa, young people are at an increased rate of dying from preventable and treatable causes. Quoting from a definition of the World Health Organization, universal health coverage means that all people, communities, and in every state can use promotive, preventative, curative, rehabilitative, and palliative health services that they need. And this has to be of sufficient quality for it to be effective, while also ensuring that nothing hinders them accessing this. Nothing like financial barriers, social barriers, economic, gender, race, nothing at all should hinder the access of universal health coverage for all young people and everyone generally around the world. However, this is not the reality for many young people and everyone else really. With challenges such as health complications and life-threatening risks from things such as early and unplanned pregnancies, drug and alcohol abuse, violence, contraction of diseases and infections such as HIV and AIDS, and many others.
speak a little slower for the translators. We were all want your passion. It's great. I have a lot of great energy. Everybody wants to hear it. So take your time.
Yes. So sorry, but yeah, with health complications and increased risks of contraction as a result of early and unplanned pregnancies, drug and alcohol abuse, contraction of HIV and AIDS, and other sexually transmitted infections due to factors such as illiteracy and inaccessibility of information and services to do with sexual reproductive health, rights, and information, and generally also just these really bad and harmful practices such as female genital mutilation and child marriages. And I believe that child marriages is not a thing. We should never call it child marriages. Such a disgusting and pedophilial act should never be considered as child marriage. There is no way a child can be married off, and we actually call it that. These are big issues that are affecting many young people, especially girls, and these issues do need to be addressed. Other hindrances to accessing universal health coverage are things like illiteracy and ignorance. And for the sake of this assembly, I am speaking about health illiteracy. Health literacy is the degree to which an individual has the capacity to obtain, process, and understand basic health information and services needed to take and make appropriate health decisions. However, this is not the reality of many young people in Africa. Not everyone knows that they're supposed to access certain health services. Not everyone knows about the diseases that are out there. Not everyone knows what their right is and that they can actually demand for these things. Many people actually have access to universal health coverage as a privilege, and hence there is need to highly invest in the education and the need for health literacy amongst young people, because ignorance is the deadliest disease that we can ever fight. And the more ignorant people are, the less we come closer to achieving universal health coverage. Poverty. I mean, it's universal health coverage. One of the biggest things that was even mentioned earlier is it is highly dependent on the finances and the needs of people. Poverty is the biggest issue, actually. It's even bigger than ignorance, because it contributes to this. Ladies and gentlemen, allow me to read you a few statistics about certain conditions that are taking place in Africa. According to the World Population Review, in 2015, 75% of the world's poorest countries were located in Africa. Less than 20% of women in sub-Saharan Africa have access to basic education, and women in Africa are more likely to face complications due to childbearing and pregnancy. Also, every 30 seconds, a child dies because of preventable and treatable causes in Africa. Also, 1 in 3 people living in sub-Saharan Africa are undernourished. Additionally, every year, sub-Saharan Africa alone misses out on $30 billion as a result of things being compromised, such as access to proper water and sanitation services, leading to things like diarrheal diseases. Imagine that. All that money is being lost just because someone doesn't have access to clean water. That's a very devastating state, and everyone has to take this seriously, because we then not only miss out on money, but we miss out on productivity. We miss out on people who actually have ideas and solutions, living the life that they ought to live. We miss out on a continent flourishing and achieving what it can, simply because someone doesn't have access to a proper meal. And these issues have to be addressed. Poverty is way more costly than we actually think. We spend more money as a result of poverty. Hence, poverty has to be attacked and it has to be reduced. Ladies and gentlemen, with this said, this is the world that we, the young people, want for our health. We need a youth-responsive and friendly health system. The goal should never have been for us to have a youth-friendly corner. Like, let's have a tree somewhere, it's got a shade, let's get a bench, and let's gather young people around and tell them about their sexual reproductive health and any other services. No. The goal was to have a youth-friendly and responsive health system. I I should be able to go to school and still be treated for any health complications I have. I should be able to walk on the streets and be able to get information that I need concerning and pertaining to my health. The whole system has to change. It's not just about an institution. It's about everything being integrated to suit the needs of every young person out there. That deserved a round of applause. Additionally to that, young people should never and must not be viewed as a by the way. There is no way that programming can be done and towards the end we're like, oh, by the way, we forgot to mention that young people need these programs. No, we should be involved and included, and we should be there from the beginning, from the planning phase to monitoring to evaluation. Everything has to revolve around young people. We should never be taken away from whatever system it is. We should be incorporated, and we should be core of every agenda. Health. I like what was mentioned earlier, and we've got so many political rivalries, we've got so many issues going on, and that really gets to me because politics initially was there not to serve as a problem to the people, but it's there to create an environment that can meet the needs of the people, and it's there for the good of the people. But that's not the case with the world we have today. Politics have taken over so many things and taken away the solutions that to the problems that we're facing today. I believe that health itself should not be part of a promise of a political manifesto. A politician should never come here and say, oh no, if you vote for me, I'm going to provide health services. That should never be said, because it must be expected, it must be granted, it must be given to us. We must access it regardless of who is in power. Health should never be tampered with. And hence, I believe we should change the narrative. Health is not a political issue. It is not a way for you to gain the favor of the people. It is a social issue, and it has to be granted. Hence, I appeal to every policymaker, to everyone in power, do not mess or tamper with the health sector of any nation. Leave it as it is. Grant it as it is. It is your responsibility. The power we give you is to serve us, and it is not for you to decide whether it should be granted or not. It should, and it must be. Additionally, when it comes to addressing the government and everyone else, it is very interesting because a few years back we were talking about the Abuja Declaration, and I think only one African country from the African Union was able to achieve allocating 15% towards the health sector, and that is quite devastating because it then shows it then gives us a reflection of how much health is a priority in these nations. And as we have already established, health is the most important commodity, and hence I do appeal to every policymaker out here, the government, whoever is in power, to do and influence this. We want to see more done to invest in key areas of every young person's health. These areas should include, amongst others, their sexual and reproductive health, their mental health, their physical health, their access to proper water and sanitation, the need for them to know about preventative and treatment for non-communicable diseases. This investment should be reflected in increased budgetary allocation, not just towards health, but adolescent health. Because it's not enough to say 15% goes towards health and only 1% goes towards adolescent health. That's such a poor reflection, and we should put up our socks on that issue. Another thing that has to be done is an increased approach towards scaling up female empowerment. I believe that most of the issues that we're facing today, for instance, things like health illiteracy, most of the people affected by this are women. We've got issues such as gender equality, and I love what was raised because it was there that there is need for gender equality to be there and to be seen in the reflection of health leadership. Let us empower our women and girls to know more about their health, to take action and charge over their health, because it is these key role players that are what is the missing link between us and achieving universal health coverage. If a mother knows or is literate about her health, she will be able to make decisions about her whole family, and hence we must consider that. An investment in women and girls always reaps sparingly. Let us invest in women and girls in whatever way we can. Community engagement in itself is indispensable. Community actors and leaders must take a stance to achieve universal health coverage. I believe the media has got so much power, for instance, to influence whatever is going on in the world. Hence, I appeal to people like the media. Use your influence to influence the minds of people towards achieving universal health coverage. I appeal to mothers, to teachers, to religious and traditional leaders, to everyone out there who's actually a community actor. Let us not leave the fate of the health of communities to doctors and the government alone. We all need to take a stance and actually do whatever we can to move towards achieving universal health coverage. These are my following messages to key stakeholders. The government, again, I emphasize, increase and invest in young people's health. Be accountable and provide ways for us to actually hold you accountable on decisions that you make in relation to our health. Make health literacy a priority. We lose more people to ignorance more than actual diseases itself. Make favorable and implement already existing policies towards us achieving universal health coverage, especially for young people. To the international community, it is always quite interesting to know that we have conventions and meetings and all these things, and we are able to discuss and have deliberations and discuss problems and solutions. But then if all we do is talk and end there, then we really haven't accomplished anything, but just spent billions on dollars to sit down. We must do our best to actually go back and act on whatever we decide on here. The time to talk is no more. We need more action now than ever before. Hence, I appeal, let us unite, let us learn from each other, let us raise our flags in unity towards fighting whatever barrier we have against us achieving universal health coverage. Otherwise, I appeal to us all. Partnership is key. Action is even more important. Let us act on this. And lastly, I want to appeal to NGOs, CSOs, the UN, the media, service providers, both private and public, and community actors. The government can only do as far as maybe creating policies and providing training and making money available, but we create the environment for which young people can actually access these services. I will emphasize again, it is not just about us talking about young people being there. It is not just about young people being the face. It is about changing the whole system, and we need everyone to collectively take part in this. Hence, continue the great work, but do understand that we have a lot more to do to create an enabling environment for young people to actually access all these health services that we need for us to flourish and thrive. The nations of everyone depend and rely on how we, the young people, are flourishing. Health is key, and it is one of the most vital commodities for us to develop and grow. Hence, I appeal to everyone, do your best to invest and put us young people first. Involve us, make us priority, and let us work together towards achieving universal health coverage. Thank you.
Wow. And now Dr. Tedros would like to give you a medal for your global health leadership. Thank you, Natasha. Thank you so much, Natasha. Wow. We have a lot of hope for our future with future leaders like these who are already taking so much action. So with that, there are those who bravely work to help shape the world to make it a healthier place and have literally sacrificed their lives to ensure access to life-saving services no matter where people live. WHO and its partners, including member states, are doing incredible work around the world in all areas pertaining to the triple billion targets. And sadly, this sometimes comes at an unbearable cost. The healthcare workers are sometimes killed or injured in the line of duty. And one such tragedy happened on 19th of April in the response to Ebola in the Democratic Republic of Congo, when we lost our dear colleague, Dr. Richard Valery Mouzoko. We would like to pay special tribute to Dr. Mouzoko and unveil a plaque for his distinguished service, which will be displayed at the WHO headquarters in Geneva. Before inviting representatives of the Mouzoko family on stage, Dr. Tedros would like to say a few words.
Yeah, thank you. You can all see the incredible contribution Dr. Richard made in life and the heartbreak of his passing. His death is an enormous loss for WHO and the people of DRC, who he was serving when his life was so brutally and senselessly taken away last month. It's also an enormous loss for Cameroon. Dr. Richard was a proud son of his country, Cameroon, and I thank the government of Cameroon for its support for the Ebola response and for its support for Dr. Richard's family, because it's for them that the loss is the greatest. They have lost a husband, a father, a son, a brother. Our hearts go out to you all. The defining mark of Dr. Richard's life was service of others. He put himself in harm's way so that children, families, and communities at risk of Ebola could receive the care, support, and dignity they deserve. Dr. Richard Valery made the ultimate sacrifice, but that sacrifice will not be in vain. It's thanks to people like him that we have made progress against Ebola, and it's thanks to people like him that the epidemic will be defeated. I had the honor of attending Dr. Richard's funeral in Cameroon, in his hometown, Bafia, a few weeks ago, and the privilege of meeting his wife and their children. I was so moved by the love demonstrated for Dr. Richard, not only by his family, but by the whole community. I would like now to invite Dr. Richard's family on stage to unveil the plaque that will live at WHO as a permanent reminder in his life and sacrifice. Please welcome them. When I met the family in Bafia, Cameroon, I had the privilege, as I said earlier, to meet the widow here with us, and also the first daughter. And they have actually 4 children. And the first one is Margaret, the second is Simon, and the third is Emmanuel, and fourth is Nathan. She's 12, the eldest daughter, and the youngest is 6. In between, you have the 8 and 10. Imagine what sacrifice Richard paid. Not just his death. Also, his death affects the family and 4 young children. And that's why we chose to honor his sacrifice in front of you, because I know you're proud of people who are responding daily to defeat not only Ebola, but other health problems that we have globally. So thank you so much again for joining us, Madam and Margaret. And we're very happy to have you here. And we will do everything to support you in any way possible. Thank you.
Thank you. Thank you. And I believe that Dr. Tedros would like to also give a medal and some flowers. Thank you. Thank you. Okay, thank you. Unfortunately, Dr. Mouzoko is not the only colleague serving with WHO and its partners who have lost their lives in the service of global health. So to remember and honor all of those who have lost their lives since the last time that we have met here, I'd like to invite us all for a moment of silence. It is now with respect, admiration, and gratitude that we would like to share the next video in a tribute to all those who work in health emergencies.
Disasters, conflict, and outbreaks of infectious diseases have shown that the world remains at risk from health emergencies that can have a global impact. We work with countries to save lives and protect health in every stage of an emergency, from prevention to preparedness, response, recovery, and health system strengthening. 24 hours a day, 365 days a year, WHO's global surveillance works to detect potential health threats. Over 7,000 signals are picked up every month. In 2018 alone, WHO identified and responded to 481 new health threats in 141 countries and territories, trained over 4,000 people in disease surveillance, lab work, and health security, supported the vaccination of 61 million people against yellow fever, almost 60,000 against Ebola, and shipped 20 million doses of the oral cholera vaccine to high-risk populations in places like Yemen and Nigeria. We protect people's health all around the world every day. None of this would be possible without our partners.
And now, for our final component of this morning's high-level segment, it is with great pleasure that I'd like to invite Dr. Tedros back to the stage to address this World Health Assembly with his remarks. Thank you, Dr. Tedros. Thank you.
Dr. Bukong Sihabong, President of the World Health Assembly, and Your Excellency, First Lady of Kenya, Margaret Kenyatta, and Excellency, First Lady of the Republic of Congo, Antoinette Sose Nguesso, Excellencies, Ministers, Excellencies, Heads of Delegation, colleagues, and friends. For 71 years, the world has come together in Geneva to discuss how we can create a healthier, safer, fairer world. This year is no exception. Over the course of the next 9 days, we will all do a lot of talking, maybe too much talking. But we must also listen. We must listen to each other. We must listen to the voices of young people like Natasha, who will inherit the world we live them. By the way, when Natasha was walking yesterday, I met her yesterday, I didn't know even she knows how to talk because she was quiet all the time. And now you, I'm so surprised. So that means she speaks when it's necessary to speak, which is very important. And Richard, my friend, also said the same thing, that we should listen. And we must listen to the voices of those who are not here, those who have no voice, those who have been left behind. It's them we're here to serve. Today, I want to describe the achievements of the past year, and according to each of the 3 billion targets in the general program of work, through the stories of some of those people. Of course, to summarize all of WHO's achievements from the past year is an impossible task. The WHO results report provides a much more detailed and easy-to-read account of the impact we have delivered with the resources entrusted to us. Needless to say, 2018 was an incredible year. First, the world has made great progress towards universal health coverage. Last year, I mentioned Kenya's ambitious plans to implement a new UHC scheme with support from WHO. In December, I had the honor of being with President Kenyatta for the launch of that program in Kisumu. It's already producing results. This is Immaculate Otene, a 33-year-old mother of 4. Immaculate is unemployed and her husband often goes without work. But thanks to Kenya's new UHC plan, designed with support from WHO, her family can now access free health services. She says, I quote, "Just knowing we can access treatment anytime has removed the worry and anxiety that my husband and I used to have. My whole family is now registered, and I can take any one of my 4 children to hospital without hesitation," end of quote. And this is Bolu Rambav Omble, a 65-year-old laborer from Pune in India. About 10 years ago, Bolu began to complain of pain and swelling in his knees. It turned out he needed a knee replacement that would cost 3 times more than his entire family earns in a year. Then Bolu discovered that he was eligible for free surgery under India's new Ayushman Bharat insurance program, which was launched last year with support from WHO. A week later, Bolu had the operation and began physiotherapy. He is now back on his feet and back to work. We could tell similar stories from South Africa, which passed a national health insurance bill last year, or the Philippines, where the Universal Health Care Act was signed into law in February this year, or Egypt, which last year passed a new universal health insurance law to be funded in part by a new tax on tobacco, or El Salvador, which just a month ago passed a new law to integrate health services, introduce innovative health financing, increase access to primary health care, and improve regulation of the Medicines Agency. Or Greece. This is Pantelis Liosis, an 80-year-old retired musician. He has had cancer twice, with regular visits to public hospitals and private doctors. But thanks to Greece's health system reforms, he now has a primary health care clinic just 10 minutes from his house, where he pays nothing for care. With support from WHO, Greece is expanding its network of primary health care clinics with an emphasis on services for health promotion and prevention. The Declaration of Astana, endorsed by all 194 member states last year, was a vital affirmation that there will be no UHC without primary health care. Primary health care is where the battle for human health is won or lost. Strong primary health care is the front line in defending the right to health, including sexual and reproductive rights. It's through strong primary care that countries can prevent, detect, and treat non-communicable diseases. It's through strong primary health care that outbreaks can be detected and stopped before they become epidemics. And it's through primary health care that we can protect children and fight the global surge in vaccine-preventable diseases like measles. That's why primary health care is at the heart of Immunization Agenda 2030, our new strategic initiative, which we're designing with you to maximize the power of vaccines. Because we cannot achieve health for all without vaccines for all. Of course, strong primary health care depends on having a strong health workforce, working in teams, doctors, nurses, midwives, lab technicians, community health workers. They all have a role to play. But the world is currently facing a shortfall of 18 million health workers to achieve and sustain universal health coverage by 2030. It's imperative that all countries invest in jobs to close that gap and deliver health for all. In addition to WHO's work supporting stronger health systems, we have also contributed to significant progress against many of the world's leading causes of death and disease. Just last month, we celebrated a historic milestone in the fight against one of the world's ancient diseases, with the launch of the world's first malaria vaccine in Malawi and Ghana, which is being rolled out based on recommendations from WHO's Strategic Advisory Group of Experts on Immunization. This is Gilembeta Taziona and her 5-month-old daughter, Lusitana. Last month, at the Mitundu Community Hospital in Malawi, Lusitana became the first child in the world to be vaccinated outside a clinical trial with the world's first malaria vaccine. But even as we introduce new tools, we're also working to make better use of the tools we have through the High Burden, High Impact initiative to reinvigorate progress against malaria. Last year, Uzbekistan and Paraguay were certified as being malaria-free. And at this assembly, Argentina and Algeria will join them. Congratulations to both Argentina and Algeria. Last year, we also launched a new initiative to eliminate cervical cancer, which kills more than 300,000 women every single year. This is Laura Brennan, a 26-year-old Irish woman who lost her battle with cervical cancer in March of this year. In the last 18 months of her life, Laura became a vocal advocate for HPV vaccination and worked with the WHO European region to promote it. We have now developed a draft global strategy for elimination, and we have supported the introduction of HPV vaccination in 13 countries and screening and treatment in 10 countries. We know how important WHO's normative work is to member states. In the past year, we have produced hundreds of new normative products that are being integrated into health systems all over the world to protect and promote health. We released the 11th edition of the International Classification of Diseases, ICD-11, ready for adoption at this assembly. We pre-qualified 200 products, including the first heat-stable rotavirus vaccine. We published the first essential diagnostics list. The special program on human reproduction published research showing that a new formulation of a drug to prevent life-threatening bleeding after childbirth is safe and effective as the gold standard. The first UN high-level meeting on tuberculosis saw unprecedented political commitment from around the world to end the world's deadliest infectious disease. As part of our commitment to reducing the global burden of maternal and infant mortality, we developed a new framework for action on quality midwifery education. We launched a new strategy on snakebite envenoming, the global status report on road safety, the global action plan on physical activity, the first guideline on dementia and cognitive decline, and our first guidelines on digital health, to name but a few. Together with our partners, we are also stepping up the fight against antimicrobial resistance, one of the most urgent health threats of our time. Just 3 weeks ago, we delivered the report of the Interagency Coordination Group on Antimicrobial Resistance to the United Nations Secretary General. We are now fully committed to implementing the recommendations of that report with the Food and Agriculture Organization of the United Nations and the World Organization of Animal Health and other agencies. Let me now mention a few highlights from our efforts over the past year to keep the world safe. Last year, WHO responded to 481 emergencies and potential emergencies in 141 countries. On this platform, a year ago, I described my recent visit to the Democratic Republic of Congo, where WHO was responding to an Ebola outbreak in the western province of Equator. That outbreak was controlled in just 3 months, but shortly after it ended, another outbreak started, this time in the eastern part of DRC. And as you know, it's still going. I would like to commend my brother, Dr. Oli Ilunga, the Minister of Health of DRC, and the government for their leadership and commitment to ending this outbreak. By the way, Oli is joining us now after long absence because he chose to be in the field, camping even in the field, to fight Ebola. Thank you so much, my brother. We can be proud of the fact that so far, the outbreak has not spread outside 2 provinces in DRC. But I emphasize, so far, the risk of spread remains very high because this outbreak is one of the most complex health emergencies any of us have ever faced. We're fighting one of the world's most dangerous viruses in one of the world's most dangerous areas. We're fighting with even better tools than we used to extinguish the Equator outbreak in 3 months. So far, we have vaccinated more than 120,000 people, and we now have evidence that the vaccine is more than 97% effective in preventing Ebola. We also have 4 experimental treatments that we have used to treat 800 patients. But we're not just fighting a virus. We're fighting insecurity. We're fighting violence. We're fighting misinformation. We're fighting mistrust. And we're fighting the politicization of an outbreak. Since January, there have been dozens of attacks on health facilities in North Kivu. Every attack disrupts our operations. Every attack makes it harder to reach communities. Every attack gives the virus an advantage and a disadvantage to the responders. Every life lost is a tragedy, but every life saved is a triumph. This is Faustin Kalivanda, an Ebola survivor from Beni. Faustin lost his wife and his 5-year-old daughter, Esther, to Ebola. Despite this tragedy, Kalivanda believes that as a survivor, he has a duty to protect others. He now works at the Ebola Treatment Center as a nurse assistant. These are the stories of hope that keep us going. When I visited DRC following Dr. Richard Valery's death, I discovered that our staff were shocked and shaken, but undeterred. They told me, I quote, "We're here to save lives. We will not be intimidated by violence. We will finish the job." I have also met personally with His Excellency the President of DRC and opposition leaders to urge a bipartisan approach to ending this outbreak, because Ebola does not take sides. It's the enemy of everybody. Unless we unite to end this outbreak, we run the very risk that it will become more widespread and more expensive and more aggressive. I have also briefed the Security Council twice on the outbreak, the Secretary General, and I have agreed on a further strengthening of the response across the entire UN system. But of course, Ebola is not the only emergency to which we're responding. Last year, we also responded to the largest recorded cholera outbreak in Yemen, diphtheria in Cox's Bazar, the ongoing humanitarian crisis in Syria, and many others that didn't make the headlines. And together with our partners in the Global Polio Eradication Initiative, we have launched a new strategy to address the most difficult remaining areas in Afghanistan and Pakistan. Earlier this year, I came across a video of a man called Irfanullah, wading through snow to deliver polio vaccines in Pakistan. With the dedication and commitment of people like him, I have no doubt we will succeed in making polio history. Excellencies, ladies and gentlemen, we have a moral duty to respond urgently and effectively to outbreaks and other emergencies. But it makes no sense either morally or economically to continue spending money responding to emergencies without investing in preventing them. That's why we have set up a new division of emergency preparedness in addition to our existing work on emergency response. We will save more lives and more money if we support countries to put in place the measures to prepare for and prevent emergencies instead of waiting for them to happen. The third of our triple billion targets is to see 1 billion people enjoying better health and well-being. Let me spend a few moments talking about our achievements in this area. In October last year, we hosted the first global conference on air pollution and health. Every year, 9 million people are killed by the air they breathe. This installation simulated what it's like to breathe the air in several cities around the world. I only spent 5 minutes inside, and that was hard enough. The simulation was hard enough. Millions of people spend a lifetime breathing air that's killing them. At the end of the conference, leaders from national and city governments made more than 90 voluntary commitments and set an aspirational goal to reduce the number of deaths from air pollution by 2/3 by 2030. We're working hard to secure many more ambitious health commitments of this kind at the Secretary General's Climate Action Summit in September. We have also completed the first phase of our new initiative on climate change and health in small island developing states. As you know, climate change affects the whole world, but small island states are disproportionately affected. We have now completed 3 rounds of consultations with ministers of health and environment from the Pacific in Fiji, and with Indian Ocean states in Mauritius, and with Caribbean countries in Grenada. We now have a much clearer idea of what the countries need and are moving into implementation. Last year was also an important year in the fight against tobacco. The protocol to eliminate illicit trade in tobacco products came into force, further strengthening the world's only public health treaty. This gives us a powerful new tool in the fight against the evil of big tobacco. But the more countries that ratify it, the more powerful it will be. If your country has not yet ratified the protocol, I urge you to do it as soon as possible. In response to our call to eliminate industrial trans fat from the global food supply, 28 countries have now introduced limits or bans covering 1/3 of the world's population. The International Food and Beverage Alliance, which represents some of the world's largest food-producing companies, has officially committed to adhere to WHO's trans fat elimination target by 2023. The High-Level Commission on Non-Communicable Diseases delivered its report, and most of its recommendations were included as commitments in the political declaration at the UN High-Level Meeting on NCDs last year. We are now working with countries to turn those commitments into action. Several countries have also introduced new measures to address risk factors for NCDs, including taxes on sugary drinks. So, as you can see, it has been an extremely productive 12 months. I have only just skimmed the surface of everything WHO has accomplished. Once again, of some of the activities. Excellencies, ladies and gentlemen, I said last year that one of the keys to WHO's success was a transformed WHO. In March, we announced some of the most wide-ranging reforms in WHO's history. there are 5 components to our transformation: a new strategy, new processes, a new operating model, a new culture, and a new approach to partnerships. At this assembly last year, you approved the new general program of work with its emphasis on outcomes and impact, which is a major shift in the plan, is that the plan is based on outcomes and impact. This year, we're asking you to approve the program budget that supports that plan. And we're now developing an operational plan to execute the GPW. Our new processes are based on best practices to modernize the organization, cut bureaucracy, and make us more responsive. We have already started implementing some of these new processes. Our new operating model is designed to help us operate as one WHO, horizontally and vertically aligned, with clarity of roles and responsibilities at all 3 levels, with agile teams to break the silos and deliver results. But the best strategy, the best management tools, the best processes, and the best operating model won't deliver results unless we have the right culture and mindset. Our new values charter, launched last month, is one of the important ways we're changing that. And our new approach to partnerships is helping us move from a risk-averse organization to one that manages risk. This is not just a slogan. It's already changing. Already we're engaging much more proactively with civil society organizations and the private sector. But all of these changes are about one thing: impact. Our transformation is about delivering results for the people we serve and value for money for those who entrust resources to us. It's about investing in science and the world-class technical expertise for which we are known. It's about strengthening our country offices to deliver results where it matters most. It's about investing in a talented, motivated, and diverse workforce and empowering them to excel. It's about being the trusted health leader that you expect us to be. And it's about strong partnerships that leverage the comparative advantages of our partners. One way we're doing that is by expanding our network of global health champions. And today, I'm pleased to announce that we have appointed Her Excellency, former President Ellen Johnson Sirleaf of Liberia, as Goodwill Ambassador for Health Workforce. And we have also appointed Mr. Alison Becker, goalkeeper from Brazil and Liverpool, together with his wife, Dr. Natalia Lowe Becker, as Goodwill Ambassadors for Health Promotion. And we have appointed Ms. Cynthia Germanotta, who with her daughter, Lady Gaga, is the founder of the Born This Way Foundation, as Goodwill Ambassador for Mental Health. I'm delighted that Cynthia is with us today, and President Sirleaf will be with us tomorrow. But Cynthia, if you can show yourself. I welcome each of our new Goodwill Ambassadors. I look forward to working with each of them in the coming years. Excellencies, ladies and gentlemen, the next 12 months will be decisive for global health. We have all the ingredients for success, but I believe there are 3 priorities that must guide our discussions this week and throughout the next year. First, health is about political leadership. The G7 meeting in Beatrice and the G20 in Osaka will be important moments to reaffirm the place of health on the international agenda. And in September, the world will come together in New York for the first high-level meeting on universal health coverage. I am asking each of you to do everything possible to ensure that your head of state or head of government attends this historic event and makes concrete commitments to universal health coverage. Second, health is about partnership. The Global Action Plan on Healthy Lives and Well-being for All is a unique opportunity to leverage the collective power of the global health. Architecture to deliver the health-related targets in the Sustainable Development Goals. We are now working with our partners to finalize the action plan, which will be presented at the General Assembly in New York. We ask that every country endorse the plan, but we also need your partnership as our member states. This week, we're asking you to approve an ambitious budget, but we're also asking you to support that budget with more flexible and predictable funding. The first WHO's Partners Forum in Sweden last month was an excellent step in that direction. Tack så mycket, Sweden. Last year, we also launched WHO's first investment case, and we're working on fresh approach to resource mobilization. To broaden our donor base, I'm also pleased to announce that the WHO Foundation will be established this year, which will enable us to generate funding from previously untapped resources. But finally, and the third one, health is about people. This week you will make resolutions and decisions on community health workers, antimicrobial resistance, patient safety, pandemic influenza, and much more. But the ultimate outcome of our work this week is not resolutions and decisions. We all have a duty to make sure the decisions we make this week take root in our countries and communities. This week, I ask you to remember the people from your family and your country, and from every family and every country who will be affected by the resolutions you pass and the decisions you make. They are the reason we are here. The people of the world are looking to us to deliver results. And the people of the world will hold us accountable for those results, as Natasha said. Thank you so much. Merci beaucoup. Shukran jazilan. Muchas gracias. Shishi spasiba. Thank you. አመሰግናለሁ. I will add my language too. Thank you.
Thank you, Dr. Tedros. Thank you so much. That was great.
Released, yeah?
Yeah, thank you. And so with that, we come to the conclusion of our high-level segment. So we'd like to thank all the participants and thank you for your participation and for your partnership. Thank you.